Hi families, welcome to this guide that will help you better understand the Individualized Education Program, or better known, the IEP process. So if your child has recently been referred for special education services, you may have questions about what happens next. So the IEP process can feel overwhelming, especially when families are unfamiliar with special education terminology and procedures. So the purpose of this presentation is to explain the IEP process in a family-friendly way, including the referral and evaluation process, who participates on the IEP team, how assessment information is used to determine eligibility for your child, the role of professional ethics, and the major components that go into an IEP. Most importantly, you, our families, are essential members of the IEP team, and your knowledge and perspective are so important throughout this entire process. So, under the Individuals with Disabilities Education Act, or better known as IDEA, a parent or public agency may request an initial evaluation when there is a suspected disability. Before the school conducts the evaluation, parents must receive appropriate notice and provide informed consent. Once consent is obtained, IDEA generally requires the initial evaluation to be completed within 60 days, unless the state has established a different timeline. So state requirements may provide additional procedures or timelines. The evaluation should be comprehensive and should not rely on a single test, but a multitude of tests. The team will then consider information from multiple sources, such as assessments, classroom observations, teacher information, developmental history, parent input, communication skills, behavior, adaptive functioning, and relevant medical information. So IDEA also requires evaluation procedures to be non-discriminatory and appropriate to the child's language and communication needs. IDEA recognizes disability categories, including autism, deafblindness, deafness, hearing impairment, intellectual disability, emotional disturbance, orthopedic impairment, other health impairments, specific learning disabilities, speech or language impairment, traumatic brain injury, visual impairment, including blindness, and multiple other disabilities. For children ages 3 through 9, states may also use developmental delay as an eligibility category. It is very important to remember that having a diagnosis does not automatically mean that your child would qualify for an IEP. The team must determine that the child meets the requirements for a disability category and, because of the disability, needs special education and related services. So the IEP team is developed by a team because no single person has all of the information needed to understand a child. The required members generally include the child's parents, who are one of the most important members on the IEP team, at least one general education teacher when appropriate, at least one special education teacher or provider, a representative of the public agency, and an individual who can interpret the instructional implications of evaluation results to help you better understand. Other individuals with knowledge or expertise about the child may participate, including related service professionals. The child should also participate when appropriate. It is not always necessary, so when appropriate. Each person contributes a different area of expertise. Parents understand their child's strengths, interests, culture, development, communication, and experiences outside of school. So general education teachers understand classroom expectations and the general curriculum, while the parent understands their child more than anyone. Special educators will also provide expertise in specially designed instruction. There are related service professionals such as a speech language pathologist, occupational therapist, physical therapist, school psychologist, and they all will contribute specialized information and strategies. Effective collaboration means the team members listen to one another, they communicate respectfully, they clarify responsibilities, and they focus on the child's strengths and needs. Professional communication should be clear, respectful, culturally responsive, and family friendly to make sure that you understand exactly what's being talked about, especially because it's your child. Technology, including secure email, virtual meetings, and other approved communication tools, can also help team members collaborate when used appropriately and in accordance with privacy requirements. So the Council for Exceptional Children, or CEC, provides ethical principles that guide special education professionals in their work with students and families. So these principles emphasize respecting the dignity and rights of individuals with exceptionalities, maintaining high expectations, using professional knowledge and evidence to guide practice, collaborating with colleagues, and developing respectful relationships with families. All of these principles are especially important during the IEP process because professionals should listen to families. They should communicate in understandable language. They should respect family culture and perspectives and include families, you, in educational decision making. For example, imagine a young child who has difficulty communicating during classroom activities. The family explains that the child communicates more successfully when given extra processing time and visual choices at home. So the teacher and speech language pathologist can use that information when developing classroom supports and communication goals. If the child is able to express preferences, the child can also participate by identifying favorite activities, interests, or special communication methods. So this example demonstrates that family and student input can directly influence the support and goals that all go into an IEP. So assessment. I'm sure you're wondering, where do we get the data? How do we find out if our child's eligible? So an assessment is an important part of determining eligibility, but assessment is more than simply giving a test. So families and professionals collaborate to gather information from multiple sources. Parents may provide developmental history, medical information, outside evaluations, and observations from home. Whereas teachers can provide classroom observations, work samples, progress monitoring information, and information about how the child responds to instruction and requests. Specialists may provide speech, motor, behavioral, psychological, or other evaluation information to help us better understand your child. Medical conditions may also be considered as well. For example, IDEA's category of other health impairment can include conditions such as ADHD, diabetes, epilepsy, asthma, or Tourette syndrome when the condition results in limited strength, vitality, or alertness and adversely affects educational performance. However, a medical diagnosis by itself does not automatically establish eligibility for special education. The team must determine whether the child meets IDEA's eligibility requirements and whether the disability results in a need for special education and related services. So this collaboration use of assessment data really helps the team make decisions based on evidence rather than assumptions and allows the team to identify both the child's strengths and areas where additional support may be needed. The IEP is a written plan that describes the child's current needs and the educational supports that the school will provide. So first, the IEP includes present levels of academic achievement and functional performance. This describes what the child currently knows and what they can do, and how the disability affects participation and progress. Next are measurable annual goals. So these goals identify skills or outcomes that the child is expected to work towards during the year. The IEP also identifies special education and related services, supplementary aids and services, accommodations or modifications when appropriate, and information about the frequency, location, and duration of the services. So the IEP explains how the child will participate with non-disabled peers and how progress towards goals will be measured and reported. So it also addresses participation in state or district assessments when applicable and other special factors relevant to the individual child. So for young children, the IEP should really focus on meaningful participation in developmentally appropriate activities and educational environments. One of the most important concepts in developing an effective IEP is alignment. So the different parts of the IEP should not be separate or unrelated. Assessment information should identify the child's strengths and needs, and those needs should lead to measurable goals. So the goals should guide specially designed instruction, accommodations, related services, and other supports. Progress monitoring information should then help the team determine whether the plan is working or needs to be revised. So for example, if assessment and classroom data show that a child has difficulty communicating needs, the IEP should include a communication-related need in the present levels, an appropriate measurable goal, instruction, and supports that will address communication and a way to monitor that progress. So this alignment will help ensure that the IEP is individualized rather than simply a collection of services. The team should also consider the least restrictive environment, meaning that children with disabilities should be educated with non-disabled peers to the maximum extent appropriate. As we wrap up, remember that you are not expected to navigate the IEP process alone. We are always here to help you, and your IEP team is always here to help you. You are such an essential member of the team as the student's family, and your knowledge of your child, including your child's strengths, interests, communication style, culture, development, their experiences outside of school, all of that provides information that professionals wouldn't have otherwise. So you can ask questions, share concerns, review evaluation results, participate in developing goals, discuss services and supports, and monitor your child's progress. So an effective IEP team respects each other. They respect each person's expertise while keeping the child at the center of every decision. The IEP is more than just a document. It's a collaborative plan that's designed to help your child access education, participate meaningfully, develop important skills, and make progress. So when you, our families, and professionals communicate openly, using assessment data responsibly, following ethical principles, and aligning the different parts of the IEP, we can all create a stronger educational plan for your child. Thank you so much for taking the time to learn more about the IEP process. We are always here to help. Please reach out with any questions.